athlete, and today we'll be talking about ACL, anterior cruciate ligament tears, and reconstruction. There are approximately 200,000 ACL tears with about 100,000 reconstructions performed each year. An ACL tear can happen to anyone. I know this from experience because I personally tore my ACL 4 years ago. There are many reasons as to how people can tear their ACL, to many ways to go through reconstruction. First, I'm going to talk about what exactly happens when you tear your ACL, who it happens in and why, and finally, reconstruction of the ACL. There are many ligaments in your knee. Your anterior cruciate ligament is located pretty much right in the middle of your knee and is there for stability. The main sports or activities that are being played or performed at the time of tearing your ACL are soccer, skiing, football, basketball, and gymnastics. To explain what happens to your knee while tearing your ACL, I'm going to talk about my own experience. I was playing basketball in 8th grade when I went up for a rebound and came down. My knee went in, I heard the pop and felt the tear on the inside. It was instant pain. I happened to do it right in front of my bench, right in front of my teammates and coaches, so everybody saw it and knew what had happened right away. Now I'm going to show a video of a girl tearing her ACL.
The watershed has definitely afforded, my entire family that second chance. The demons of addiction had taken me hostage.
You can see her knee go in when she
They
goes out to
had
pivot.
taken over my life in a way that I can't even explain. Nothing could make them.
Well, when I discovered she was having trouble, it was a shock to me and a surprise because she was probably the last person I would expect to have this kind of problem.
I'd always been, very happy, outgoing.
When you tear your ACL, you end up stretching the ligament past this point of the elasticity. There are partial tears and full tears, depending on how far you go. ACL tears can happen to anyone, but are most common in women. Women are 4 to 10 times more likely to have an ACL tear than men. The physical build of a woman's body make them more prone to tearing their ACL. Some of these assets are that women's hamstrings are weaker and can affect the knee, which can put stress on the ACL. It's also that women's knees usually go in more, so it's kind of like being knocked in. And with the strain of the knees and having that inward motion, it makes it easier for them to tear their ACL. Luckily, there's a way to fix the ACL. This is known as ACL reconstruction. ACL reconstruction is a surgical tissue graft which is usually done arthroscopically. They go in, take out the torn tendon, like that one, and replace it with either your own hamstring graft or they take the graft from a cadaver. This is where they take out the hamstring graft. And then they put the graft in and secure it with screws. So they put it in and then you can see the screws in there that they use to keep it in. After surgery comes recovery time, which consists of physical therapy. Recovery time is usually about 7 to 9 months. You start with going to therapy just a few days after surgery because they want to get your range of motion back. You usually have this workout that you have to follow before you can start doing more things. You slowly start your way from bending your knee, trying to get some motion, to walking on the treadmill, to running more on the treadmill, and then to jumping. At the end of your therapy and recovery time, before they let you return to sports or activities, such as running, you have to pass a test to get this clearance. Once you get the clearance, they'll give you their note to return, and you'll usually have to end up wearing a brace for so long until your knee has back its full strength. As you can see, tearing your ACL can be a very hard injury to get through. There are many steps you must take in order to recover. In the end though, you're usually good as new and can go back to any of the activities that you did before.